Video. Ah, now. Yes.
Correct.
Yes.
Okay. So I just thought, anyhow, the last slide I wanted to put, anyhow, thanks to the AOS, thanks to the West Bengal, and I'm life member of both. And as Subhashish said, I love Bengal. And Subhashish, you look like Rabindranath Tagore. So that's what the look you are giving. And I wanted to say that so you look like me and Santosh, no, black hair. And a reality check during Retina practice. So all of us know the pandemic. So we have this hand sanitizer using the foot pedal, the non-contact thermal, and then the outpatient where we don't have the sweat arm shield. The only thing here is in indirect we have fixed the shield, which we use it, and I avoid outpatient. Very rarely I see. I do the teleconsulting. I make my junior consultants or maybe the senior retina consultants to see, and I do a teleconsultation using the video, and I only operate. And but this patient was is a IPS officer, so I had to come and see. And this I finished the OT and I came down. I wear the PPE, and that's the optometrist. And this is how the face shield and the optometry workup done. And then this is scrubbing I'm doing, and this is how I operate. I call as a Maharaja chair. I have a backrest, I have an armrest. Everything is sterile covered, and this is how I use the 3D. And the glasses again help us along with the PPE. I'll just show you, and then everything cleaning. All of you have focused on that, and including the fogging. And then the other one is I actually test every patient whom I am going to operate or give injection for COVID. And I had a story. I have a story here. We had a patient whose father and mother had COVID, and then she is 37-year-old, and the father was sensitive, so he tested her, and it was COVID negative. And the patient had branch retinal vein occlusion. Being young, our Hitesh Sharma consultant asked for a vasculitis workup. In that, he asked for HRCT, and she had HRCT positive for COVID. So I requested the father and mother. I said, I don't want to give the injection. Why should I be unnecessarily exposed? And with a great difficulty, a week we postponed. It was not an emergency, neither urgent. The vision was 618 with the macular edema due to BRVO. And 1 week later, my senior consultant Jaydeep gave the injection. And this is the reality check that you can see the OPD patients, and then you can see the January, February, March. Both the retina total consultation and retina consultations is very poor, but it's slowly picking up. And that's why I like Santosh and ours. And that's the retinal procedure, which is again showing the decline, which is all over. And I'm happy all over the world it is like that. And the main thing is, I think, the fear of contracting COVID, both the physician, the ophthalmologist, the paramedical staff, the patient, financial instability. And then the main thing is we are all now again in the COVID era, we don't prefer a five-star food, we prefer home food. So similarly, I think we have to do some new now. And we are also encouraging teleophthalmic consultation, and we started in March 27. And I recommend that for me as a senior vitreoretinal surgeon. I ask everybody, and I convinced, I think, 99%. And I think I'll not do OPD anymore. I'll probably do only teleconsultation between the first floor of my hospital and the third floor, and also reduce the cost to patient by reducing the visit, and which will reduce the risk of COVID-19 transmission. And teleophthalmology is the way to go. And I think we have to make sure that our own operated patient easy to do, and encourage patients need, and only patients who need surgery should come. And we have the sanitizing done daily, temperature done, and checking the rest of the nearest hospital, the hospital. And only patient is allowed, and the relative asked to wait outside one at a time in the counter, and optometrist is also one at a time. So the doctor and optometrist are equipped with the PPE, sanitization done, and which I think all of us do with an to care everything is sanitized. And that's the operation theater, which I wear the PPE and scrub, then I wear the regular OT clothes. And plus, I do the 3D surgery. I love to do that. In a way, good, you are away from the patient. And the main thing is I tell them, because it's going to be a prolonged surgery, the draping, particularly near the nose so that the no air comes through the drape. If you put it wrong, it may fog, but more than fog, we are worried about the air content from the patient. So we also have a face mask. I request the patient to put a plaster so that the air will go, and then the entire thing is hope so the all the air will be below the drape. And I wear a double glove from 90s where I started doing the first to do the HIV patients. I wear the footwear, I wear the foot cover, everything what the COVID is required, and I think I'm used to it now, and I enjoy operating. And I think the one precaution is we have a gap between if we have 2 or 3 surgery. Almost I make it a 20 minutes to 30 minutes gap, so that I tell them don't do in a hurry. Shift the patient, make the air is also not there. And so I want to conclude my talk because I think everybody spoke a lot. So I want to conclude being we are talking in the land of Bengal. So take up one idea, and here the one idea will be make every ophthalmologist prosperous during COVID, and make that one idea your life. Think of it, dream of it, live on that idea. Let the brain, muscles, nerves, every part of your body be full of that idea, and just leave every other idea alone. And this is the way to success. And I think Swami Vivekananda born in Bengal, and he came to Tamil Nadu, went to the Indian Ocean, and gave the enlightening thing to the world, and said, "Oh, India, sitting in the rock memorial, which is a memorial now, but he was in the rock there." Thank you.
Thank you, sir.